The dirty little secret that PT practices use to crush their competition. It's not about being the best clinician, it's about mastering the art of patient expectations. What is the patient's expectation of physical therapy? Well, I'll tell you exactly what it is. It's pain relief. It's really nothing else. How many times have you seen a patient come to physical therapy and say that the reason they came in was because their motion was limited? Yeah, it's happened, but it's pretty damn rare. They go to the doctor because they're in pain. They get surgery because they're in pain. And yes, we indeed are in the pain relief business. There's no doubt about that. But we have an obligation to our patients to give them a bona fide outcome from physical therapy. Clinically, it's assumed that the patient comes to PT because they want to be rehabilitated. Well, they do not. In the main, they're just there to get out of pain. So it's your job to articulate what rehabilitation would look like, and you do that by promoting your four-phased approach to care. What is the four-phased approach to care? Well, I'll tell you how it started. Many years ago when I had my practice, my marketing director would go out and knock on doors and visit with physicians, and she spoke to physicians on a regular basis. And we had an incredibly successful back rehabilitation program that doctors were very curious about. Our practice was known as the best in town in treatment of spine-related conditions. Doctors were always asking our marketing director, Linda, can you tell me a little bit about our back rehabilitation program? How does that even work? So she wasn't really sure how to describe it. So the marketing director got with me to ask me how I'd recommend that she answer that question. I go, well, it's pretty simple. I just told her to tell the doctors we have a four-phase approach to care. She was like, what's that? I said, well, here it is. In phase one, we're going to focus on getting the pain and inflammation under control. In phase two, we're going to focus on improving range of motion, general flexibility without exacerbation of symptoms. In phase three, we'll start working with strengthening and core stability. Again, being careful not to aggravate whatever symptoms they have. And in phase four, we'll add aerobic activities to get the patient back to work or sport or normal ADL. And she goes, wow, that sounds really, really good, really smart. Well, if you're a physical therapist and you're listening to this, you're like, duh, this is like an everyday occurrence. Yeah, I know it really is, but sometimes it's how you package it. It can make all the difference in the world when you package it as your four-phased approach to care. It's your special sauce. It's the reason you're so successful, your patient outcomes is due to your four-phased approach to care. It can actually catapult you above other practices. Our marketing director would answer the question, can you tell me a little bit about your back rehab program, Linda? And she'd start presenting the four-phased approach to care. We did that with doctors. These guys have MD after their name and nobody queried it. Linda, my marketing director, would say, well, doctor, we have a four-phased approach to care. In phase one, we work on getting the pain and inflammation under control. As the patient moves into phase two, we start working on improving general flexibility and mobility without aggravating the symptoms. In phase three, we start working on strengthening core stability to support the spine and its normal activities. And as the patient moves into phase four, we add a little bit of aerobic activity at the patient's tolerance level so they can get back to work or sport or normal ADL. And doctors would say all the time, that sounds like a very sound program. In actuality, it is a sound program. It's a sound program that every physical therapist on the planet uses, but you packaged it better. It was good enough for doctors. It's absolutely good enough to present to your patients. We use this four-phase approach when talking to physicians to simplify our back rehabilitation program without any backlash from any physician saying, well, that's pretty general, or I wanted to know something more specific. If it's good enough for MDs, it's good enough for your patients. So how do you present the four-phase approach to care to a patient? Well, here's what you'd say. Especially when the patient has a more chronic condition, this really fits nicely. You'll find a point during your initial evaluation where you'd say, Bob, I want to tell you about our treatment approach and how we are going to get you better. We have a unique approach designed to get you back and functioning. And now I know that you're having a lot of pain, but your body was having trouble before the symptoms of pain began to show up. I'll give you an example of what I mean. Have you ever had a cold before? Of course. So you know by the time you got the sniffles and you started feeling achy, you had the bug in your system for a little while, right? Well, the same thing happens with your back pain. We can treat the symptoms, but if we fail to address the cause, you'll end up riding a roller coaster of up and down pain. Bob, we have a four-phased approach to care. It's the reason we have such fantastic results, and it's the reason that doctors refer to us like crazy. In phase one, we're going to work on getting the pain under control. We know that that's the reason that you came in to see us, right? We want to get it under control. As the pain begins to ease up, we don't want to come back, so we'll begin to move you into phase two. And in phase two, we're going to work on improving your general range of motion, your flexibility, and we're being careful not to aggravate your symptoms. We do this so that we can move you around easily and you can move yourself around more easily with a lot less pain. So once you start moving through phase two, we're going to move you into phase three. And in phase three, we're going to work on some strengthening. You've heard of the core? Yeah, we're wanting to do some strengthening of the core, around the tummy area. We want to support your low back so that you can move move around without aggravating your symptoms. At that point, we'll begin to move you into phase 4. In phase 4, we begin to add a little bit of aerobic activity. Now, I'm not trying to make you into a runner or anything like that, but I want to kind of tax your musculature just a little bit so we can see, what kind of endurance you have so that you can get back to out in the yard or whatever you really like to do. So those are the 4 phases of care. So Bob, throughout each visit, I will always orient you to each thing I do and what phase of care I'm addressing so that you can see the progression. If I'm working on something to improve your mobility, I will say something like, Bob, this is a phase 2 stretch to improve your flexibility of your middle back area. This is a phase 3 exercise to strengthen your core. This is a phase 4 exercise to improve your muscle endurance. Does that make sense? The patient's going to get it. So how do you solidify this in the practice day to day? Well, when the patient walks in, the receptionist says, hey Bob, what phase of care are you in? Oh, I'm moving into phase 2. Awesome. Everybody walks by and says, hey Bob, what phase are you in? I'm moving into phase 3. Why is that important? I'll tell you why. It's because you get the patient into the proper mindset that pain relief is not the goal. They can see that they have to go through 4 phases and not just 1. If they just go through phase 1 only, well, they're a quitter. And you've made it pretty clear that there's 4 phases of care, and it's precisely what's needed to manage their condition and to get better. It's a 4-phased approach to care and not just 1. Now you might be thinking, this sounds great, but how do I actually implement this in my practice? Well, here's the step-by-step process. Number 1, during initial evaluation, introduce the 4-phase approach to care right from the start. Explain each phase and why it's crucial for their long-term health. Number 2, have regular check-ins at each visit. Tell the patient what phase you're working on and why. This keeps them engaged in the process. Step 3, staff alignment. Train your entire staff to reference these phases. Have your clinician ask other clinicians' patients, what phase are you in? And also have the reception ask the patient what phase they're in when they come in. Visual aids. Create posters or handouts that explain the 4-phased approach to care. This reinforces the concept visually, like slap it up on the wall, point to it, make it known. Step 5, have some progress tracking that you could consider for the 4-phase approach to care to celebrate the patient's progress through rehab, right? This can motivate the patient to complete their entire plan of care, resulting in a successful discharge and not getting dumped. If you continue to bring up what phase the patient is in and exactly what you're doing in each phase, you're going to have a patient who is less likely to dump you, more likely to follow through with the plan of care, and most likely refer a friend or family member, and of course, making more money. Look, I know that this might seem like a small change. You might be thinking, I already do this, right? I don't have to label it. Trust me, the simple act of naming and explaining these phases can have a profound impact on your practice. When I first implemented this approach in my own practice, I saw an immediate result. Patients' compliance skyrocketed. We reduced self-discharges by over 50%. And most importantly, our patient outcomes improved dramatically. But here's the best part. Our revenue per patient increased by 20% in the first year alone. Why? Because patients stuck with us through all 4 phases instead of dropping out after reaching their goal of improved pain relief. So here's my challenge to you. Implement this 4-phased approach to care into your practice over the next 30 days. I guarantee you'll see a difference in not just your patient outcomes, but your bottom line as well. But you must get all staff involved. Remember, this isn't about changing what you do. It's about packaging and communicating it effectively. Every PT uses these phases in some form, but by explicitly structuring and naming them, you set yourself apart and you provide clarity to both the patients and the referring doctors. And here's the real kicker. This framework isn't just about patient care. It's about transforming you from the overwhelmed PT owner to a confident CEO. By implementing systems like this, you can start to step out of daily patient care and focus on growing your practice. It's the first step towards breaking that $500,000 revenue ceiling and building a thriving multi-location practice. If you want to learn more about how to implement this approach and other strategies to take your practice to the next level, I put together a free program on how to fully implement the 4-phase approach into your practice, along with a killer poster image to download. Just click on the link below and you'll get instant access to start transforming your practice today.